Welcome to UMDF's Ask the Mito Doc monthly webcast. Tonight we will embark on a special format, coffee and conversation with 7 clinicians joining us in 4 breakout rooms. We have Dr. Scalia in breakout 1, Dr. Marava Kosiks and Dr. El Sharqui in room 2, Dr. Grotman and Dr. Lashman in room 3, and Dr. Ganetsky and Dr. Vernon in room 4. Each room will have our very own ambassadors moderating discussion around the themes of Mito 101 and patient rights and responsibilities. Please do not enter the rooms until we instruct you to do so. Our Ask the Mito Doc webcasts are made possible through the generosity of sponsors, so we ask that you join us in thanking the Edith Trees Charitable Trust and UCB for their ongoing support. Okay, let's get started. You can now go ahead and proceed to your desired breakout room, and if you need any help, just let Jessica know and she can help you out. Enjoy.
All right, we're going to get started so that we can get the conversation going. We're running a little bit behind. I am Beth Whitehouse. I'm the Director of Development with the United Mitochondrial Disease Foundation. Unfortunately, I'm not live on camera because my laptop is not compatible with me sharing my video and also the screen that will help guide today's discussion. Working for a nonprofit has bonuses that you don't have to share your video, right? Anyway, first and foremost, we are recording. I welcome you to breakout number 4, Parents and Caregivers, Patient Rights and Responsibilities for the Mito Patient. We have with us today 2 docs who are super docs, Rebecca Ganetsky from Children's Hospital of Philadelphia, as well as Hillary Vernon from Johns Hopkins School of Medicine in Baltimore. So thank you so much for being with us, docs. And we also have our superheroes, UMDF ambassadors, Stacy Taylor and Jenny Hobbs. So Stacy and Jenny have a lot of background in both of these sections that we're going to be talking about. And again, myself, Beth Whitehouse with UMDF. I have to just share with you a little bit. Some of the discussion themed topics today will include, but are not limited to, insurance, Medicaid waivers, IEP, and medical records. I do want to share that the docs may not be superstar heroes in some of these sections, so if they're unable to answer your question, Jenny or Stacy will take a shot at it, and if we can't figure it out, we'll get back with you. So I think with that in mind, we can start, and I'm going to, since we have a small group, I'm going to ask you to unmute, and that way we don't have to use the hand raising. We're just going to have conversation and just monitor it that way. If we get more people into the room, then we will go back and mute. So if you want to take some time, Elizabeth, Rhonda, and Betty Marie, please introduce yourself. And Elizabeth, you're the first to unmute, so welcome.
Hi, I'm Elizabeth. My daughter is Tanner. Dr. Ganetsky is actually her doctor, so that's why I found this tonight. So she is 8 and she has Lee syndrome. And so, yeah, I'm just here to learn more tonight.
Wonderful. Welcome.
Elizabeth, what did you say your daughter's name is?
Her name's Tanner.
Tanner.
Yes.
Very good. And Rhonda, do you want to unmute yourself?
Sorry. Hi, my name is Rhonda. My son actually just turned 18. Dr. Vernon was briefly our doctor before we moved to Pennsylvania. Probably doesn't remember because that was like 12 or 14 years ago.
Well, I was maybe still a resident then.
With Dr. Kelly.
I was still a resident. Yeah, I was actually a fellow maybe at that point. Yeah, so that's a while ago.
Yeah, it was a long time ago. So now we see Dr. Goldstein at CHOP. And yeah, I just saw this and I sometimes just like listening.
Very good. Welcome, Rhonda. And Betty Marie, I'm going to ask you to unmute as well.
Hi, I'm here with my mom, and her name's Betty also. I have mitomyositis apathy, and I live in southeastern Pennsylvania.
Wonderful. Thank you for being with us, both of you.
Yes.
Thank
All
you.
right. So let's open it up to questions. Anything that, again, the topics of conversation are listed here. You can go in any order, whatever you're itching to ask the doc or one of our ambassadors here at UMDF, please feel free.
Don't everybody talk at once. And I think the other thing, as you know, as Beth mentioned during her intro, is don't feel constrained by those topics. Sort of the broad topic for this breakout room is patient rights and responsibilities. And when we were talking about what that really means, one of the things that we talked about with the ambassadors and UMDF staff was that really, just sort of generally speaking, it is your right and your responsibility to understand. So what does that mean? You know, when you're at an appointment, or if you have any communication with any provider, whether it's your primary care provider or the doctor who's managing the Mito case, or one of the subspecialists that you see, or whoever it may be, do you understand what your next steps are? Do you understand the lab results that you're getting? Just do you understand? And that is your right, obviously, that you should understand whatever is happening with your care, but it's also your responsibility. And I think that's where a lot of us as patients and caregivers, I don't want to say fall short, because that really puts the onus on us, but we don't want to ask questions. We sort of feel like it's not our place to ask questions. But it is, like, it really is. We need to understand what's happening. So it sounds like some of you, Elizabeth and Rhonda and Betty Marie, like maybe you wanted to come in and just kind of listen to what the conversation was. Maybe we can start with what our physicians feel like patient rights and responsibilities are.
Hey, do you want to start? Yeah, I was going to say, Rick, I don't know if you want me to take a stab at this. One thing I found is that electronic records have been greatly helpful in linking some facilities together, but not all. And so it's really tricky. I know this, of course, for my own kids, for keeping track of the tests that have been done, lab values, imaging, and things like that. But it's very helpful if those things are collected in some way when you're coming to a first-time visit, because it's surprising. It takes sometimes us longer to track it down than if it were there in the first place. So I have a wonderful, wonderful administrative assistant, and we'll send her out to try to find records. And she is trying for weeks and weeks and weeks on end to find things. So sometimes I find it's easier to just collect it up front. The hospitals we can link to, the stuff's right there, but it's kind of amazing. One of the main hospitals near us is Children's National, and we share a lot of patients, and we actually don't connect to them. So I often find myself on the phone calling and saying, can you pull up this lab? Can you pull up this image? It's unbelievable. So I think that is one thing that all of us could be very helpful about, us giving you copies of everything when you come to the office, saying, here, keep these for yourselves, and bringing them when you see other physicians as well.
That's a really good tip. And I actually, just to let you guys know, I'm in Baltimore. My kids do get some of their care at Hopkins, and they used to be at Children's National, and I had a heck of a time getting information for myself, getting my kids' records out of Children's National. So that's a really good tip. And I feel like, we used to get advice. My kids are a little bit older. I know, Rhonda, you said your son just turned 18. We always used to be told, like, to have the binder with all of the records in it. And nobody really does that anymore, because there's electronic medical records. Like, why would you carry around a binder?
I'm so happy when a family comes in with a binder. Like, oh, this is everything I need right here. And there's the genetic testing section, and I love it.
Right. That's so funny. So maybe we need, some of the like definitive information still in that binder, or at least easily accessible in like a Google Drive or something like that, that's really easy to access when we're in the office, and that we can share very easily. So, all right, thanks for that.
I do still have a binder, but I really, and I put some things in it, but I will say, like, with CHOP, the Mito Center, like the letters you get at the after your visit, they are so comprehensive, and they just extend, right? So it just builds on, so nothing is deleted from like previous. So you just kind of get this running dialogue of like everything that's happened. So while they may end up being like 50 pages long, at this point, that you can like have this one place where you go back, and it really has kind of the highlights, I guess, the critical part. And it started with sending in all of our previous information when we first transferred there. And just, I don't know, whoever's poor person's job was to like take all of that and then decide what's the most important to collect. And I know for us, we have an appointment with the transition to adulthood team that apparently they create something similar. So electronic is nice, but it doesn't, I have had the same thing where some of the records just don't go through. And our local hospital is Lehigh Valley Health Network, which is supposedly connected to CHOP, but like for whenever we have blood work done for endocrine, for some reason I end up taking like screenshots and sending it, or she ends up having to like get somebody to track it down and collect it, which is, I know, like just extra work for anybody.
I think, having that, both the comprehensive binder, but, I think to me, the other big part of it is when there's an emergency, being able to communicate the critical information quickly. And I think that having names for what your condition is both a right and a responsibility. So I often tell the story of when I was a fellow and an emergency room doctor called me and he said, I have a patient here and they're having an emergency and they have a metabolic disease. I said, okay, which one? And he said, a rare one. And I was like, well, that does not help me, right? Like they're all rare. And I think as we get into more precision medicine, how I respond to a patient with loss, who's at risk for having a stroke, versus a patient with Kernsayer, who's at, acute risk of hypocalcemia or cardiac conduction defect, or like each of those things is different. And so I think, having, and for some families, your disease is rare enough that it's like, mitochondrial disease type 137 or whatever that is. But, having some key phrases, whether that's in the form of an emergency room letter, whether that's in the form of a phraseology that you can use, or my personal favorite, and I've said this on so many UMDF calls, everyone knows I feel this way, having the person that you call who's able to explain it to a doctor in the setting of an emergency. And for different families in different places, that's a different type of doctor, right? That might be your primary care doctor, that might be your neurologist, that might be your geneticist, it might be a hematologist and a neurologist. It depends on what's going on with you, but having that person or that team that is the team to reach out to when something's happening, to me is really the most important, right? And it also takes a lot of work on the part of each individual family to build that team and make sure that you've communicated and you've specifically asked them, do I call you when I'm having an emergency? How do you want me to get in touch with you? Do you have an on-call team? Do I not call you and I call someone else instead? What do you want me to do?
Yeah. And I think that's one of the things, and I'd be interested in hearing what the other parents on the call think about this. I think that's one of the things that is challenging for parents is just asking questions in general. Maybe it's changing, but I think so many of us were raised as, you go to the doctor, you have the exam done, you do what the doctor tells you, and you leave. You don't ask questions, you don't argue. The doctor knows, you just do what the doctor says, and that's it. You just follow directions. And, I definitely see it with like my mother and my in-laws. But I think particularly if there's any kind of a language barrier or a cultural barrier, but even when there's not, I feel like there's kind of that, like a level of, I don't want to fear almost that like, oh, I'm not supposed to ask any questions. I'm just supposed to like, whatever they say is what I'm supposed to do. And, that's it. I don't know. What do other parents think? Do you feel that way at all?
I think some of it was sort of like growing up as sort of a level of respect for authority. But I think some of it too, like from my experience, at least when you are initially given that diagnosis, you're kind of in shell shock and you don't know what questions to ask.
Mm-hmm.
And you sort of take the information and you're like, okay, like I wouldn't, if a physician didn't hand feed me the information of, here's my number, here's how to reach me in emergency, here's an emergency letter, this is what you do, I wouldn't have known to ask all of those things. So I'm really grateful that I had a doctor that did all of that for me, because I wouldn't have known, even though we had been through several emergencies prior to ending up at that doctor. I still wouldn't have thought to ask that question. So I'm grateful that you guys have that ingrained in your head as metabolic doctors to go, this is what you need. You take this letter and you give this to the ER doctor and have them call me. So I hope everybody has that. And then I think over time, like Stacy and I both have older kids. Like my oldest Mito kid is 21 now. And so that's a lot of years of dealing with things. And so over time, that's a lot of years of knowing to go back and not just ask questions, but question, are we sure this is the right thing, or I'm not sure I totally agree with this plan, or we've had this problem, so can we do this instead? Or, and you've had that many years of relationship with your doctor that you actually have a relationship with them at this point to have that kind of give and take versus if you just see them once a year.
Right.
Kind of just, more transactional. So I think all of those things kind of play into it a little bit.
What do you guys think?
I
don't know who that was.
Used, we were in the ER locally a little over a week ago. My son has adrenal insufficiency, so we have the whole Cortef injection, and I'm thinking I have it down, and we go there, and I don't have any letter for Mito. I just brought with me the endo letter. I don't know why. I have them all, I have them all in just a little binder right next to his emergency bag, but I just grabbed the endo letter, and then they put a bag of, they went to hang a bag of lactate ringers. And I was like, no, I don't think we can have that. I don't know. And we were, the doctor was great. But I felt but he asked what do you want? What fluids then do you want? And I'm like, just saline, I guess. I feel like I thought I knew, but I'm like, well, his sugar's okay. So I think just saline's fine. But I that was the first time that they'd ever given him that anybody, and we've been to the ER multiple times. So I'm not really sure why it never happened before or why it happened this time. What what I did differently to, I mean, we fixed it, but if it were my husband, I don't think he would have known to say, no, that's, we shouldn't have that fluid or whatever. But I don't have that. I need to put all those notes just in the bag. So I'm not grabbing them.
Or you can take a picture of it and just have it on your phone in the photo section.
That makes sense too.
Yeah, I just, because those pieces of paper get pretty raggedy after a while. So I usually just say, take a picture, put it somewhere on your phone or in the medical section of your phone. You can just pull it right up.
That's a good idea.
Yeah.
Well, now we have my CHOP, so it goes straight to the electronic medical record. It's very nice.
Yeah. So we were at LVHN though. There are certain documents that are not like seen, I don't think.
It is true. Kind of the reason that I said that was I've had families, then you can pull it up on your app.
Oh, yeah. Okay.
And actually, the apps have been so good because even the ones that don't communicate with my hospital directly, the number of times families have handed me a phone and been like, this is St. Sylvia's Hospital's medical record app. Here it is. Whatever you want to look at, you look it up. And
Yeah.
I'm like, great.
I didn't even process that to do that.
That's funny because I didn't even think about taking a picture of it. Like I have our ER letters, which need to be updated. But I have them like in my backpack that I, carry when I have to go to work. And I have them like in a little folder in the laptop compartment because that's the most protected compartment. And I have an extra phone charger in that bag as well, because that's the bag that I take to work. So, and then I'm like, well, if I have to go to the ER, then there's an extra phone charger in there. There's the ER letters in there. If I have to throw my laptop in there, or if my husband ends up going, like, fine, take that bag that has the stuff in it. But it's the letter. It's not, it would make more sense to have it electronically, but there is still, I use Google Drive all the time, but there's still some part of me that's very old school about stuff like that, but we should have it electronically. And yeah, it is available on the electronic medical record apps. Oh, I thought there was somebody else that had joined, but I guess maybe she left.
Yeah, some of them come in and out, trying to find their way.
Yeah.
I do want to tick back to the conversation about challenging docs, because to me, I think when you think about rights and responsibilities of parents and caregivers, but also us, I think very relationally. And I think one of the rights and responsibilities that parents have is to be an equal team member on their team. And it's our job to make sure that you feel empowered to do that. But, especially those of you who have older Mito kids, you know more about the day-to-day realities of mitochondrial disease than Hillary and I do, right? We've seen a lot of kids with mitochondrial disease, but I don't go home to a kid with mitochondrial disease. And the number of times that a parent has asked me a question, I've been like, well, Dr. Konetsky, do you think maybe this thing is related? And I've been like, no. And they've been like, well, all the moms on Facebook think that maybe it's related. I'm like, okay, can you tell me more about like that and what they're saying? And then I've learned something. Mm-hmm. So I try really hard to make sure that I'm open. But I also am seeing a lot of Mito patients, and sometimes my brain is filled with, what the catastrophe that's going on with someone else's Mito patient right at the particular moment in time. And so I would really say, like, we should do a good job. But if we've fallen down on our job, please take this as an open invitation to ask any doctor anywhere a question, or say, I really don't understand. Can you explain it to me again? Or I really—
Are you saying that doctors are human beings?
We're people. We're people.
What?
Oh my God. We're people. And we're imperfect. And
I think it probably is really challenging because you are probably having a lot of people coming in like, well, I saw on Facebook I saw a post on Instagram where somebody shared a meme saying I should take XYZ, and you're probably like, oh my God, please don't get medical advice from Facebook. But the reality is that is where a lot of people are at least sourcing information. You're going to like and maybe it is a reliable resource. Like you're going to the UMDF Facebook page and saying, hey, other parents and caregivers, other adults with Mito, this is what's going on. What's your experience? What do you suggest? But it could also be, sort of the cuckoo cachoo group where, you have no idea who you're talking to.
And that's really hard. Like I try to be super open all these years about like, if you find it and you're going to try it, just let me know. I'll be honest and open with you, and I will not be judgmental about it. Like that is definitely something I've learned over the years, is just show me what you've got and let's make sure it's safe and we'll work with it. Because I'm not a mind reader. I don't know magically what's going on, but again, over the years, I've really, really learned just not to be judgmental about anything and just see what you got, see what you found, and let's see if it's something that's safe and we can try.
And I think especially in the rare disease space.
Yeah.
So like,
yeah,
I'll pick on ECHS1 because it's easy to pick on, right? I like to pretend to be an expert in ECHS1 disease. I've had 13 patients, which I think is 4 times bigger than the next biggest cohort. And I had one of my ECHS1 families come and ask me, like, does this and this medication work? I can't remember exactly what the medication was anymore, actually. I was like, I've never even heard of that. Where did you hear that? And they're like, well, someone in the Facebook group uses it. And I was like, there's an ECHS1 Facebook group? And they're like, yes, there's 57 kids on it. And I was like, excuse me? Like, I'm sitting here with my 13 kids and Facebook has 57 and you guys all talk to each other and you can ask questions. And so I would say, be skeptical about the internet. The internet can be a weird place. People on the internet are often sick. But building community is amazing. I mean, this is why I come and do these UMDF talks, right? Because I really believe in the power of community, not just for support, but also for asking those questions of like, hey, this actually worked for my kid. And can we propagate that faster than one doc, even in a big center, could see that many people with a specific rare disease?
Oh, Jennifer's back.
Jennifer, you want to ask unmute. Do you have a question or any comment that you'd like to make? And again, even though the discussion theme topics are listed here, it doesn't have to be specific, not limited to it. Feel free to comment. It goes for Elizabeth and Betty Marie too.
I have a question, I guess. With an IEP, we homeschool right now, but if she was to ever go back to public school, how like, I know the school has to listen to the doctor, but like, how much kickback is the school allowed to push to say, like, say the doctor says, she can only go to school half days or something due to fatigue. How is the school ever allowed to push back and say, we really would like her there more, or come more days or something? Because that is one of my fears of her going back to school, is because right now she stays home and she can sleep. She can get a full 12 hours of sleep. We can do school around when she has the most energy, and then she's not completely exhausted by 3 o'clock in the afternoon. And my worry is if I kind of give her back to the school, they continue to take, and then I'd be fighting them, and I don't want to fight them. but she would love school, but I don't want to fight the school.
I don't know, like, honestly, what the, like, my son has had a shortened school day since he started middle school, because they just start so early in the morning, and it just, at that point we just thought like waking him wasn't what we would get, what he would get out of school wouldn't, we would like lose the value of the time he was there. So if we had to wake him for, 5:30 or 6 o'clock in the morning to get him there for a 7:05 start, what he would get out of the day would be so much less than if we just brought him at 9 o'clock and let him have a shorter day. I just got a letter from the doctor, and that was it. Like, there was no, now we'd already in elementary school, like the last probably 45 minutes to hour of the day, we had already demonstrated like he was napping. He would end up, they had a spot for him and he was sleeping, and it was already pretty clear that like the length of the day was a little bit much for him. But I didn't get any pushback from the school. And then since COVID, well, I think I'm going to blame it on puberty, really sent my son into like a spiral of other things. Like he was doing pretty well, like medically, I guess, before puberty. And I think I'm thankful that it happened during COVID, because we were home for it. He started having seizures that he never had before. He was diagnosed with the adrenal insufficiency, and between the seizures and the medications for the seizures, he was sleeping like all the time. And so when it was kind of time, like we no longer had the option to be virtual unless we did like the cyber school, but I didn't at that point, they knew him, they saw what was happening. And so we got instruction in the home, and that's what we did for, I guess, the first year post-COVID. And now he does like a work-based learning program. He goes in, like the bus picks him up at 10:45 in the morning, 3 days a week, Monday, Wednesday, Friday. He gets speech in person, and then he goes to like a job site with a job coach and a nurse and a one-on-one, and one or two other kids are there, and then they go back to school and he comes home, and that's it. So he picked up at 10:45 and he's home at 2:45, 2:30. And I haven't had any, like, they just did it because I think they just saw what was happening. Like, it was just kind of this gradual. I didn't have any pushback. I haven't had an updated letter that we need this. Like, I think everybody sees it. They see like they see what happens if he had a bad night's sleep. They, and it just, I don't know. So I feel like I don't know if we've just been lucky with it, that we've had plenty of battles with the school. Don't get me wrong. We've had lots of services not being met, but that hasn't been one of them, in terms of just accommodating the fact that we have, I guess, a diagnosis of suspected Mito. We don't have like a genetic finding, but nobody has ever given us a hard time with that. But again, he's older, and it was more of a gradual progression of, I guess, maybe an inability to handle a full day.
Mm-hmm. My experience with schools has been really mixed. Some do give a lot of pushback. They want kids in seats, and others don't. And there's a whole range in between of kids with homebound, kids with part-time. But ultimately, the school is legally required to give the kids the education that they have a right to in the least restrictive setting. And so if they think that I think, what you pointed out, Rhonda, really makes so much sense to me. When schools see it, I don't usually get pushback. The kids that I get pushback where the parents are like, yeah, she can get through Monday through Friday, but like Friday afternoon through Monday morning, she sleeps the whole weekend. Like, we can't eat lunch together as a family because she's asleep. And the school doesn't see it. And then that's a hard, like, then the school's like, are you sure she can't come back? And I'm like, yes, I'm sure. But ultimately, despite having some pushback back and forth, and Rhonda, I really heard this in what you said too, like, you've had battles with the school. Sometimes there's a little bit of discussion back and forth, but ultimately, almost every kid that I have, we're able to get an IEP that feels right to their parents and right to me, that the school is willing to agree with.
Yeah, I'm going to echo that. I think as resource strapped as we sometimes feel in medicine, in the schools, they're vastly more resource strapped. And so I think when we try to work with them from the medical side and go in with a little bit of empathy, like, we understand that you're strapped, but this is what we need. Generally, it's gone pretty well.
Good to know. Yeah, our district is good. Right now, we have a good relationship as homeschoolers, but I always just worry, like, we creep back in there, but.
We're actually, I have 2 kids with Mito, and we're in the process really now of setting up reduced schedules for both of them. And they go to different schools within the same school district, but in different schools. And both schools are actually being really cooperative. I think some things to consider are whether your daughter is on a diploma track or a certificate track. And I don't know if that's exclusive to Maryland. I don't think it would be, but whether you would anticipate that she would be getting a high school diploma or whether she would be getting a certificate of attendance. And whether she would, if she does a reduced schedule, be able to fulfill all of the requirements for whatever, whether she's getting the high school diploma or whether she's getting the certificate of attendance. And, if she can't fulfill all of the requirements in the hours that she would actually be in the school building, then could they do, part of the time in the school building and part of the time through like a home and hospital type program where she's getting either a tutor at home or online or something like that. Those are some of the options that we have in Maryland. I don't know if they're necessarily available in all states, but one of the resources that all states do have is a parent training and information center. So it's a federal grant that's available through the Federal Department of Education. And each state and US territory has one. It's called a Parent Training and Information Center. And they help parents with navigating school issues and developing IEPs, any kind of IEP questions. It's not diagnosis specific, so they're not going to know anything about Mito, but they're going to know everything about IEPs. And you can put, I can't put the link in the chat just because of how the breakout room chat is set up.
Find it for you.
Okay. I think it should be on that resource list that we have. I'm not sure, but if not, maybe I can send it to you. But you can just you can Google Parent Training and Information Center, and you should be able to find a link where you can look up your state's Parent Training and Information Center.
Okay, thank you.
Yep, I found it. 1 second, here it comes.
Oh, great. Thank you.
I will also say in the kind of vein of resources in general, I have almost never had to use them, but there are educational law centers that provide often pro bono law counsel about what children's educational legal rights are. The one in Pennsylvania is very conveniently called the Educational Law Center. They're called different things in different states, but when families really do have a contentious issue with a school where the school, for whatever reason, can't provide what a kid needs, that's been a really good resource. Usually it's the opposite when we get them involved. Usually it's the family's like, yes, I understand that my kid is nonverbal because of their oral dystonia or whatever, but they're actually a really bright kid. And the least restrictive math class for them is like mainstream math class. Can you put them there? And the school's like, no, we can't accommodate someone with J-tube feeds and dystonia in the mainstream math class. And you're like, actually, you legally have to.
I'm finding a bunch of resources and trying to type them in here as fast as I can for you, so that before we break out into the main room again, that you can at least click on the links and save them to your browser.
Thank you.
Please continue conversing, even though I'm doing this. I'm just trying to get them off to you.
You done?
And the one that I'm going to include here too is just one of the main things where might be a little bit harder to find, but it's the resource section on undf.org. That way, if you ever are trying to find something, it's there. And Rhonda, I just wanted to share, I might have typed in Rebecca instead of Rhonda. You had mentioned that your son was not yet diagnosed, but suspected, but I put some information about genetic testing in the chat for you as well.
Oh, thank you. He's had everything. Like we have, I think, pretty much exhausted all genetic testing, thanks to CHOP. Actually, it started with Dr. Kelly and Dr. Vernon very, very long time ago. And just it said a few things come up that just don't explain like the whole picture. But
when was the last time he was tested?
I think because of the new endo stuff, they just sent the whole genome out for like the reanalysis. Like you can get it done a year later or whatever it is, because he had it done. I feel like it was only about a year ago that he had it done for the whole genome. And I think because of just some abnormal stuff that's happened more recently, they just Dr. McCormick, the endocrinologist, had requested it be repeated. Maybe they can rerun the whole genome again, right?
Yeah, very good. So, that's why I asked how long ago it was, because folks who haven't had genetic testing done in a while can do exactly that. So you're in good hands.
No we've been really blessed. I mean, we were living outside of Baltimore, and I do say, like, had we been living in the Lehigh, had my son been born in the Lehigh Valley, I don't know if he would have ever, at what point I would have like kind of given up. We were blessed to be at Kennedy, Krieger, and Hopkins when he was diagnosed first with autism, and having like all of the screening that they do there, because he was having like a lot of other things that weren't explained by autism alone. And so they were doing some screening there. I can't remember exactly what it is, but it led us to Dr. Kelly, which led to just more testing. And he had initially like a clinical diagnosis of Mito. And then at some point we moved, and we were still going back and forth for a while. And then it was just kind of a lot. We were getting more and more specialists, and it was just kind of getting harder. So I think it was Dr. Menon, the developmental pediatrician at Kennedy Krieger, who suggested we go to CHOP, which was just going to be a lot closer for us. So we made that. And I can't believe the amount of genetic testing we've had and to find nothing. So I've just kind of figured we probably will never have like a full answer, and that's okay too.
Well, you may, it's coming, it's changing. I'm sure the docs will agree with me. They're constantly finding new genes, constantly. So the research has come so far, just even since I've been with the organization for 9 years. So I don't want to stop the conversation. I'm sorry, I'm going to have to, because otherwise we're going to be moving out automatically. So I just ask that if you do have questions, certainly let us know. Hop back into the main room simply by clicking on Leave Room. You have Margaret's contact information any of us. You can even email info@umdf.org if you have other questions that weren't answered. Please stay in touch. And just a huge thanks to Stacy and Jenny, our ambassadors, and to Dr. Ganetsky. I always pronounce her name wrong, Dr. Ganetsky and Dr. Varanen for helping guide the conversation tonight, and to all of you for coming in and keeping this coffee and conversation going. I think it was successful for our first breakout room, so thank you.
And thank you for hosting and all
Thank
the
you.
resources you found for everyone.
I know, I think Stacy had texted me something and I was like, oh, here, and it was the last text, and I sent her a genetic testing link. I'm like, no, that wasn't for you. But I ended up getting it to everybody. So, all right, we'll see you back in the main room.
So I really want to thank everyone. This was, I don't know how everyone felt about your rooms. We really want to hear your feedback. But I know there was a lot of questions, and I know we couldn't get to everything, but it seemed like a very engaged group in group number 1. So I don't know how everyone else did in your breakout rooms. I do want to let you know that we will have a resource document that our ambassadors worked really hard on to pull together some resources that we will share with everyone along with the recordings. So I just wanted you to know that that will be coming. It may take us a little while to get the recordings for each breakout room together, but we will be posting those on our Mito U. I really want to thank the doctors and the clinicians for being on tonight. I hope you found it interesting and engaging and not too overwhelming for this late at night. And also the ambassadors for helping us. This was actually this coffee and conversation breakout rooms was the idea of our ambassadors and Margaret Moore. And I think it was a really great opportunity to do something different for Ask the Mito Doc. Maybe we'll do this once a year. We'll see how we've learned a lot. There was a lot of things we learned along the way here that we will remember and put into play. But I would really appreciate any feedback. Make sure you email us, and let us know if you have suggestions. And that's to the clinicians as well. If you feel like there'd be something that would work better for you, please let us know how you felt about the webcast tonight. So with that being said, I just want to thank you all, and we look forward to seeing you all again next month. I believe it is December. I could share the screen, and it will be a wrap up with our 2023 with our Mito Doc. But yes, we will have 4 or 5 Mito Docs on in December, and we look forward to seeing you all back then. Thank you, and have a good